and so on, when others have it. From there, it can spread to the groins, and the groins can become very itchy. We see it also in the armpits and actually on any part of the body. And kids can get it on the scalp. The fungal infection on the kids is peculiar to children. It's not something that adults get unless they're immunosuppressed. And then we have another variety of fungi that are called Candida organisms. And that is a yeast. I say there are three main categories. There's yeasts and molds and dermatophytes, and these are the medical terms for them. But Candida is one such example, and that can cause a rash between the digits, where the area, the web spaces between the fingers and toes, for example, become white in color, and they become macerated, and they become itchy. You can also get paronychia. In other words, you get swelling around the nails on the fingers and the toes. That's another manifestation of fungal infection. And of course, you can get thrush in the mouth and genitalia. But the common type that is relevant to our discussion tonight is a fungal infection that occurs on the feet.
Okay, all right. Talking about the feet.
Now, are fungal infections contagious, and what factors trigger their spread?
Fungal infections are contagious, yes. They're contagious not only from human to human, by the way. You can also pick it up from animals, and you can pick it up from the soil.
Oh.
So if your pet has a bored patch somewhere, it's a good idea to take the pet to the vet and get it sorted out. But the factors that trigger off fungal infections would be warmth and moisture, mainly.
Okay.
And these are the two main ingredients for fungal infection. Fungal infection can occur in diabetics more commonly than in the normal population. We see it when there is immunosuppression and through steroid use. Our audience will be familiar with steroid medications, be it orally or to apply on the body. And if one uses steroid medications for prolonged periods, it can actually promote fungal infections. Then, of course, shedding of slippers and walking on carpets with an infection in the feet. And we'll chat about what to do after wudu, for example.
All right, so if you just joined us, you on the afternoon Jam Radio Al Ansar, we are talking to specialist dermatologist Dr. Naufal Raboubi, who is the president of the Dermatology Association of South Africa. He's also the president of the Vitiligo Society of South Africa, and he's been in private practice at Westville Hospital for 37 years. You wouldn't say that, right, Amina?
You would never.
Yeah. Now, Doc, you performed a study of fungal infections in mosques in Durban. Could you please tell us a bit about the study?
Yes, in fact, I did the study with two colleagues of mine. One was Professor Abu Bakr and the other one was Dr. A.K. Peer. And we did this in 10 mosques in the Durban area. So we went physically to those mosques and rounded up all the musallis that were there for Isha Salah.
All right.
And we examined their feet.
Okay.
We looked for evidence of fungal infection.
Yeah.
We looked for evidence of nail infection and fungal infection between the toes. And if they had anything that resembled fungal infection, we took a skin scrape and a nail clipping and sent it off to the laboratory.
Okay.
And in the laboratory, they grew the fungus and cultured it, and they gave us a report to say that this person had fungal infection and that person didn't. And then we went to King Edward Hospital's office workers. And these are, of course, people who are not reading Salah. They're non-Muslim. And they are in the sort of also wearing shoes all the time and so on. But we examined them and we made a comparison between the Muslim population and those that were not engaged in Salah. And we found that our community had double the infection rate compared to those that are not engaged in, or let's say not in mosques, for example. So naturally, this is not saying that wuzu is a problem or Salah is a problem.
Yeah.
We are told for every disease there's a cure. So we must go out and look for the cure.
Absolutely.
And the fact that for every disease there's a cure, it's not denying the fact that there is disease. So we need to look for the disease and we need to find the cure. And for that reason, we made certain recommendations at the time.
Yeah.
That is to put paper toweling in mosques, and that a large number of mosques adopted this.
Have followed through that, yes.
We recommended that we use special detergents to wash the wuzu khana areas and to wash the carpets and shampoo the carpets. And that actually resulted in a huge decrease in fungal infection in the community.
Great.
Massive decline. And that was a campaign that we did throughout the mosques in many parts of the country. And that paid great dividends. And I think at this time we should actually run another campaign to educate our musallis that this is not an attack on cleanliness. Of course, wuzu is a sort of physical hygienic process.
Right.
But if you look, for example, at mosques in the Middle East, the wuzu khana is always far away from the mosque, you'll recall.
Okay,
They make
yeah.
wuzu. By the time they walk and come to the Jamaat Khana, the feet are dry.
Right.
The other thing is Middle Eastern countries are quite hot, and so the feet dry up.
Yeah.
Now, if you look at mosques in the South African context, the wuzu khana is always right next to Jamaat Khana.
Correct. Yeah.
There's no time for the feet to dry.
Yeah.
And on top of that, some would wear certain kinds of socks, for example, nylon socks and so on, and that would promote the growth of fungus. It doesn't absorb well. So you need cotton kind of fabrics to absorb. And we also made huge posters, and these posters were sent to all the mosques in the country, or many mosques, many received them,
Yeah.
and they put them out in their notice boards, showing what fungal infection looked like. And if there's a need for that, we'll do it again. Actual photographs of the fungi and what it looked like on the skin,
Yeah.
and then what to do if they had fungal infection.
Now, how does sweating and humidity contribute to the fungal infections?
The fungus thrives in that kind of environment. In other words, if you have a dry environment, the fungal is not able to multiply and is not able to grow.
Right.
But if you have a moist, warm environment, and if you look around you and you see where these fungi grow, it's always in moist environments. Even on the human body, for example, you'll see it in body folds,
Oh, okay.
right?
Yeah.
And even in obesity, when you see more body folds, you'll see the fungus thriving in those areas because it's warm and moist. So warmth and moisture are the two necessary requirements for fungi.
So now, sharing of towels. Often there used to be towels in the wuzu khana, and many people use those towels, and they're often very damp.
Yes.
Can that, and clothing as well, can that spread the infections?
Yeah, I think it's a very good idea that these days the mosques are now providing disposable paper towels.
Right.
I think it's more hygienic and that you're not going to be transferring infection. And of course, I'm pleased to say that very few musallis would pick up the towel and wipe their feet with it. They use
Right.
something different for the feet, and maybe they would use the towels on the hands and so on.
Yeah.
It's more common to get fungal infection on the feet. The reason for that is we have shoes on the whole day. And the shoes would provide a warm and moist environment for the feet. The hands are open. You don't get fungal infection of the hands often. So when you wipe your hands and your face and so on, it's usually fine with a towel. But the most hygienic process, of course, is to have the disposable towels that people wash the face and hands with and feet and throw the towels away.
So you're saying it's very necessary after wudu to wipe your feet dry?
It is necessary to wipe the feet dry. Most mosques would provide the toweling now.
Right.
And so it's a good idea to wipe the feet dry, yes. Because if you leave it moist, for one thing, you're carrying the fungus into the mosque, right? In a wet environment, it spreads more easily.
Yeah.
And so wherever you put your footprints, you'll be depositing fungi in those areas.
Right.
And the other thing is, of course, the other side effect is you can slip and fall. So it's worthwhile drying your feet before walking on the slippery tiles.
Right. I mean, you're looking-
And of course, it protects against fungal infection. It's not the only thing. I mean, you've got to treat the fungus, of course.
Right. Yeah.
Right?
And now my simple question though is, what simple hygiene habits can help prevent a fungal infection, especially after bathing and wudu? Because I know a lot of people have this inclination of that maybe if I spray vinegar before and after, it will get rid of it. Is that an old wives' tale, or does that have any merit?
No, well, we don't use there's an echo.
No, there's no echo. We can hear you loud and clear.
All right. The fungal infections are treated with medications. We don't usually put vinegar on the feet. We leave that for fish and chips. As it is, if you take your socks off after a hard day's work, it's already like a fish and chip shop.
Hey, Doc, you're right.
So what we would recommend is, of course, to get a diagnosis. And to get a diagnosis, we scrape the feet, the skin scales, and look at it under the microscope and make a diagnosis.
Right.
That's what a doctor would do. So if you see a doctor, he would scrape the skin and look under the microscope and make a diagnosis. If he doesn't have the facilities or a microscope in his office, he or she can take a scrape and send it to the laboratory and get a diagnosis.
Absolutely.
Now, once a diagnosis is made, there are certain antifungal medications that are available. For example, we can apply the antifungal medications, or we can take the medications orally. And that would depend on how severe the infection is. If it's mild and just on the surface, we would just apply medication on it.
Right.
And if it is severe, if it's extensive, if the nails are involved, if extensive feet are involved, if there's a large area of the body involved, then we would always use oral medication. And the doctor would then decide which one to give and which one to choose. There are 3 basic oral medications.
Right.
And one of them is given every day for 3 months if the nails are involved. One is given for 7 days in a month for 3 months. And one is given once a week until there's complete clearance. And the duration, of course, will depend on what we are treating.
Yeah. So now, does obesity and diabetes increase the risk of fungal infections?
Yes, both obesity and diabetes increase the risk of fungal infections. And the fungus that's usually seen in diabetes is Candida. So Candida is very common in diabetes. In fact, so common that if we see candidiasis in an individual, we almost routinely screen for diabetes.
Yeah.
That's how common it is.
How would you describe Candida? Apologies for.
That's fine. It's a fair question. Candida would depend on where on the body it is.
Mm-hmm.
If it is between the toes, the skin can become white in color and it looks wet.
Okay.
And it's not dry and scaly like we see in the other fungal infection, which we call tinea pedis, right? Or ringworm. Ringworm is a different fungus. Candida is a different fungus. So Candida would produce white maceration. In other words, where the skin rubs against each other, the skin always tears,
Yes.
right? We see that between the digits of the feet, and we see that between the digits of the hands as well. Okay? And we see it in the base of the nails, where you can get swelling of the base of the nails. And that we would see particularly in housewives and in nurses and in people who are doing wet work all the time, in domestic servants and so on, that are constantly immersing their hands in water. The detergent damages the cuticle, and then Candida organisms get into the skin fold, and it causes swelling. You don't have it, so don't worry.
Yeah, baby's checking.
He's checking, busy checking.
She's checking furiously, but I can confirm that she does not have it.
Doc would know.
Yeah, he would.
Now, Doc, you said that you did a test around all the mosques. I'm personally curious, what was the worst case that you've seen?
We've seen people with fungal infection between all the digits, including the entire sole of the feet and all the nails involved. I mean, that's severe. You need nails for fine movement.
Yeah.
If it involves the fingers, then writing becomes a problem. If you have it on the feet, then of course jogging and running and so on becomes a problem. But those individuals can also have spread of fungal infection in other parts of the body, and sometimes it starts in the groins but goes down up to the knees. Because of the incorrect medication that is sometimes used, which we can talk about. I mean, patients who have very severe and extensive fungal infection are often using cortisone creams.
Okay.
And I would warn against the combination products which contain antifungal agents and cortisone creams.
Okay.
The reason for that is when you apply a cortisone cream, it takes the inflammation away. It
Right.
takes the redness away. You don't see any redness on the skin. But it doesn't kill the fungus.
Okay.
So when we use this combination, the steroid would suppress the appearance of it, and you think it's better, so you stop. You haven't used it long enough to kill the fungus.
Oh, okay.
So
Okay.
the medication is kept away, and after a few days, it starts again.
All right.
You reach for the same medicine and put it back.
Yeah.
You suppress the inflammation, but the fungus is not killed. So the fungus grows bigger and bigger and bigger and bigger, wider and wider, and it ends up involving large parts of the body. We've seen them going across the entire chest or across the entire abdomen.
Jeez.
And very commonly, if it starts in the groins, it affects the whole abdomen and the knees, the inner thighs. So that's how it spreads. And this is why it's important to treat the fungal infection when we see it, so that it doesn't spread to all these areas. And it doesn't put the rest of the family at risk, and it doesn't put the patient at risk for other areas.
A message coming in from Meroon says, Salams, can I please have Doc's cell number? Or you can give you his surgery number or room's number at Westfield Hospital.
Perfect.
We'll do that for you. Another one says, for him, can skin disorder cause lupus?
Lupus is an entirely different condition. So lupus is an autoimmune disease. In other words, the body attacks itself, and you can get a wide variety of skin ailments with lupus. In other words, it can cause damage to blood vessels, it can cause damage to the surface of the skin, it can cause redness, it can cause mouth ulcers, it can cause problems inside the mouth and nose. In fact, it affects any organ in the body.
Okay.
And even if we look at the criteria, about half a dozen of them relate to the skin. So lupus is diagnosed by a range of criteria. In other words, there needs to be about 14 criteria to diagnose lupus, and that includes skin signs, but it can affect the liver and the kidney and the any part of the body, the heart, the brain, absolutely any part of the
Everything.
body. But we do blood tests, and the blood tests, the physical signs, and the appearance of it will then determine whether it's lupus or not. Often we need a biopsy to make the diagnosis. In other words, we take a piece of skin, we send it to the laboratory, and the laboratory then confirms the diagnosis.
Mo says, Salams, guys, Doc killed us today.
He did.
It's a good show. Always wondered where fungal infections come from. Keep up the laughs, salams and du'as. Ramadan is flying now on day 6. If you have any questions, we are in studio with Dr. Naufal Raboubi, specialist dermatologist. 060-904-1056. Keep it locked onto the Afternoon Jam right here on Radio Al Ansar.
The Afternoon Jam is brought to you by Spur, people with a taste for life.
As the sun sets and the day slows, it's time to gather, time to share, time for iftar at Spur. Enjoy a juicy 150-gram cheddar malt steak, 4 buffalo wings, 2 crispy samosas, and a chilled glass of Faluda for $219.90. Or enjoy the half cheddar malt chicken schnitzel with all the same delicious sides for just $199.90. Available at all halal Spurs till 19 March. T's and C's apply. Spur, people with a taste for life.
Get ready to elevate your fitness game at First Fitness in Durban's Berea. With a spacious free weight area, award-winning equipment, and exclusive ladies-only parking and training level, we've got everything you need to crush your goals. Hit the ground running on our outdoor track or unleash your inner warrior in our MMA and boxing dungeon. Plus, enjoy high security and ample parking. And don't forget to refuel at our Halal Coffee and Health restaurant for the best in coffees, smoothies, and healthy eats. Join us today and redefine your fitness journey. First Fitness, dare to be extraordinary.
Dreaming of your next getaway? With Show Mirage Travel, the world is within reach. From island escapes in the Maldives, Mauritius, and Seychelles to iconic cities like Dubai, Istanbul, and Egypt, we've got you covered. Sports lover? Catch Formula One, Premier League matches, and major global events live. Whether it's luxury, family adventures, spiritual journeys, or sport travel, we make it seamless and unforgettable. Book now at miragetravel.co.za or call 031 208 4222. Your journey starts here.
This Ramadan, you, zakah and sadaqah can place food on a table and hope in the heart. Tradeport Distribution offers thoughtfully prepared Ramadan grocery hampers for every intention and budget. From daily feeding hampers starting at just 25 Rand to generous hampers all prepared with care and dignity. Turn your intention into impact. You choose the goods, we carry it forward. Contact Tradeport Distribution on 083 661 5818. You know what really gets under my skin? When my cake or icing just doesn't come out right. It's such a bummer. But I found this incredible margarine called Wooden Spoon, and it's been a total lifesaver for my baking adventures. It makes my icing turn out just perfect every time. When I whip up something with Wooden Spoon, I feel like a master baker. Seriously, my cakes have never looked better. The secret? Wooden Spoon margarine. It's like the magic ingredient for nailing those perfect bakes. And guess what? It's even endorsed by the South African Bakers Guild Association. Just another quality product from the Willowton Group.
As we observe the blessed month of Ramadan, financial uncertainty can be a distraction during a time meant for focus and reflection. Anglo Wealth Sharia offers a transparent, Sharia-compliant, asset-based investment solution, giving you clear insight into how your wealth is structured with returns of up to 17% per annum. Prepare your wealth as you prepare your heart this Ramadan. For more information, call 031 566 5201. Anglo Wealth Sharia is a registered national credit provider.
The Afternoon Jam is brought to you by Spur, people with a taste for life.
Exactly where you're at. It's now 7:39. We're in studio with Dr. Naufal Raboobi, who's a specialist dermatologist practicing at the Westfield Hospital. Rashida says, Salam's Afternoon Jam. Welcome into our radio and into our homes. Asking for somebody else, how do you remove warts? Doc, how do you remove warts?
We have over a dozen ways of removing warts. The commonest we have in the practice is to freeze it with liquid nitrogen, or we can burn it, we can cauterize it and remove it. These days we are using a very sophisticated immunological treatment that is called tuberculin antigen immunotherapy, where we inject one wart and the body then detects the medicine we put into the wart and it sends an army of immune cells to attack. Then the immune cells learn how to recognize the wart and they go all over the body and clean the warts out.
Wow.
Oh, wow.
And we inject one wart and it gets rid of all the warts all over the body. And that is called immunotherapy. And that is really what we do almost as first-line treatment these days. There are many other treatments. We can use lasers, we can use destructive methods, we can use methods that peel off the skin until it goes. My suggestion is you go and see your dermatologist and let him or her have a look at the condition and explain to you what is available for your particular kind of warts and get it treated. There are many, many treatments. If you want to read, I have a comprehensive article on my own website that you might want to go and have a look. It's drnraboobi.com. And you can go and click under skin conditions, viral warts, and you'll see all the treatments listed there.
Excellent. Another question comes in. What's a good treatment for athlete's feet? Athlete's foot.
Right. Athlete's foot is really what we are discussing today. So another word, the common word for fungal infection of the feet is athlete's foot. And athlete's foot will present exactly the way we were discussing. In other words, scaling of the feet and so on. Now, if it is very mild, we can treat with topical creams like terbinafine. This is available in the pharmacy over the counter. If one is suspecting a fungal infection. We can use an antifungal powder like AF powder. And if it is very extensive, or even before that, we use medications that end with the word azole, like clotrimazole and miconazole, and all those azoles are antifungal medications.
All right.
And I think a lot of them are available over the counter as well. So if those work, it's fine. And if it doesn't work, then we use oral antifungal agents. And there are 3 of them available that I mentioned earlier. One is terbinafine, the other is itraconazole, and the third is fluconazole. The older ones, griseofulvin and ketoconazole, are not used much these days. The reason for that is you had to use it for very long. So those are the treatments for athlete's foot. And all the things, all the prevention that we mentioned just now, all of those will apply to athlete's foot. Remember, athlete's foot can spread even in swimming pools and hotels and gymnasia and all those places. So it's important if you're in a public place to wear slops. If you're going to have a shower in the gym, for example, always have slops on because you'll bring someone else's fungus home.
Yeah, you don't do that.
You know, we ran a campaign now that's called Shea or Samosas, not your fungus.
Right.
So I'm going to leave that campaign with our sister here.
Yeah.
And if anyone wants to read through, it's a light-hearted, it's an animation.
Yes.
And it teaches a lesson about how to look after yourself against fungus. So those who want it, please ask and you will get it.
Now,
Thank
this one
you.
says, Salams, I just heard recently someone's child had foot and mouth disease.
Yes.
What's the cause? I always thought it was just in cattle.
No, foot and mouth disease is a viral infection caused by a Coxsackie virus. So this is a viral infections, of course, are picked up and transmitted from one to another. You know that measles and mumps and rubella and all these are actually viruses. We had a pandemic with a virus recently. And the viral infections can be managed. They can be controlled. We treat symptoms only. Now, it's quite peculiar that for viruses, we can only treat symptoms. We cannot kill a virus in the human body. We don't have a specific medicine that will kill the virus. What we do have are medicines that will stop the multiplication of a virus. But we don't have any medicine that will kill a virus selectively and leave the human body alone, as we have antibiotics for bacteria. If we have a bacterial infection, we take an antibiotic, and the antibiotic will kill off the bacteria, leaving the body alone. Right? Sometimes you get a few side effects, but I mean, you can use it, you can ingest it and kill off the bacteria. We have internal medicines for fungi.
Right.
But for viruses, we treat symptomatically. Even hand, foot, and mouth disease that would occur in those specific areas, they make tiny little blisters that look almost like chickenpox blisters, and they occur in those areas, the hands, the feet, and the mouth. And we treat it symptomatically and relieve the itch and relieve the burning and relieve the pain and so on, and relieve the fever. And once all that is done, within a few days, within 5 to 7 days, the rash is all gone.
Now, this one says, Doc, thank you so much for an interesting topic. I soak my feet daily in Savlon lukewarm water. Alhamdulillah, it helps fight the fungal infections. I can see the difference on the big toenails. Is this right?
No, Savlon is not a remedy for fungal infection of the toenails. It might make the nail feel better because it softens the nail. If you soak your feet in water, it's easier to cut and it's easier to handle. But Savlon will not kill fungus. You need an antifungal for the Savlon. There is another medicine that I didn't mention earlier, and that is applied directly onto the nail once a week. If the whole nail is not involved, and if the nail does not reach the cuticle, then there's a medicine called amorolfine that one applies onto the nail once a week.
Right.
Until the nail grows out fully. So that can be used. But if you have a fungal infection, you need more than just Savlon.
This one says, salams to all. Dr. Raboubi is hilarious. Okay. What is lichen planus? I think if I got that right, lichen planus.
Lichen planus, yeah.
Yeah.
It comes from 2 words. One is lichen, and lichen is often used in dermatology for things that stick out of the skin.
Okay.
So if you drive along, you see on the trees, you have lichen stuck on the trees.
Okay.
You get very pretty lichens all over the place. And planus means flat, plain, flat.
Right.
So lichen planus is a condition that makes bumps on the body that look almost like Table Mountain. In other words, it's elevated, it's raised, but the top is flat.
Okay.
So it's flat topped, but it's elevated.
Yeah.
And usually it's purplish in color. And we often call it the disease of 6 Ps because it's purple and plain and polished and pruritic. In other words, it's itchy. And this is what it looks like. Now they are purplish in color. The very annoying part of lichen planus is it can affect the inside of the mouth. And it can be very painful in that area. And it can make it very difficult to eat. And the second place that lichen planus causes a lot of distress is the scalp because it can cause hair loss. And the third place is that it can cause pigmentation of the skin that can last for years.
Okay.
And this causes a lot of distress. But lichen planus is treatable. We have effective medicines for it. We have oral medicines as well as medicines that can be given externally. And please make your way to your dermatologist and discuss it and get treated. Please do not leave the lichen planus because it's a destructive condition.
Okay.
It can destroy the nails as well.
Message comes through here. It says, Assalamu alaikum wa rahmatullahi wa barakatuh. Catching the tail end of the not so fungal show. My toenail is looking darkish, like it has a shadow on it. What could it be and how do I get rid of it? And hubby has terrible nail fungal on his big toes. How do I get rid of it, please? And my daughter has chicken pox. How do I relieve this and how to get rid of the marks later, please? Jazakallah so much. And this was from It's Me.
Let's do a quick answer there.
Right.
Yeah.
Fungal infection of the nail needs confirmation of the diagnosis. So we take a scrape of the nail, look under the microscope and confirm that we can see fungi. If that's not present, then we send the specimen to the laboratory and grow the fungus. And we still can't see it, then we send it to the laboratory and they stain the nail and look at it under the microscope. That is called histology. And we've got to differentiate it from other causes of nail problems. In other words, lichen planus, psoriasis, nail injury from something that's fallen on the nail, joggers and runners and so on. This is why it's so important. The treatment is 3 months long and sometimes even longer than that. And for that reason, we need to confirm the diagnosis. So the moral of the story here is first confirm the diagnosis, then go on the appropriate treatment. If it is a fungal infection, you've got a fantastic outlook. It is possible to get a normal nail. The second thing is of course, the doctor would look at the nail and make sure it's not anything dangerous, like any tumors and melanomas and so on. As far as the chicken pox is concerned, chicken pox is a virus. We've got to wait for that to pass, or sometimes we use antiviral medications in the beginning. And the viral infection, of course, will last about a week or so and then go. The one thing about chicken pox is the virus lives in the body and later on can cause shingles. And it's the same virus that causes shingles later on. So the treatment for chicken pox is symptomatic. And if scars develop, then of course we handle the scars depending on what they look like. There's a lot of treatments for scars. In other words, we can surgically treat the scars. We can inject fillers under them. We can cut the scar out and rejoin the skin. We can subcise. In other words, we take a needle and put it under the scar so that the scar lifts up. There are a lot of treatments available. Here, the moral of the story is see your dermatologist and get it sorted out.
This one says, I have a question for doctor. My scalp is itchy, but there's no flaky dandruff. The scalp has a grainy-like sand buildup. I don't use hair products. Even after washing the hair, the scalp feels itchy. How do I treat it?
All right. If it's got grainy, sandy particles on the scalp, you obviously have to make sure that there isn't any scalp disease going on. And the two most common conditions we see on the scalp would be psoriasis and seborrheic dermatitis. Fungal infection is not common on the scalps of adults, but it is common in the scalps of kids.
Okay.
So I would advise that you get it checked and make a diagnosis first. So, for example, if we see scaling of the scalp and we see pitting of the nails and we see rash on the elbows and knees, then it will tend towards psoriasis. However, if we see scaling on the scalp and scaling in the ears and scaling in the eyebrows and along the sides of the nose, then we would consider seborrheic dermatitis. If we see nothing anywhere in the body, then of course we've got to treat the condition symptomatically and relieve the itch with medications and shampoos. And we have various medications that can be used on the scalp. We have tar and we have salicylic acid for the scaling, and that can be used. The doctor will generally have a look and see what proportions need to be mixed, and then would mix it according to those proportions. There, if you have a problem on the scalp, please get it assessed. Naturally, you'll understand that it's not possible for us to make a diagnosis over the radio.
Yeah.
We need to see the condition.
Right.
And the doctor will see the condition and know exactly what needs to be done. So please get it attended to, but it's a good question and it gave us a chance to discuss various conditions that occur on the scalp.
This one says, I have a fungus on my nail, on my fingers. Doctor said due to detergents. He recommended me to buy Fix for nail. Where can I get this medicine? Why didn't you ask the doctor where can you get it?
Yeah, no, the doctor who prescribed it will give you an idea. I've never used Fix for nails, so I'm afraid I can't answer that question. We don't use it. We don't know where to get it from, but the fungal infection that you are describing from detergents sounds like the one I mentioned earlier called paronychia.
Okay.
And paronychia would be a fungal infection of the nail in people who are dipping their hands in water and detergent all the time that damages the cuticle. And you know that cuticle is like putty on a glass. So if you don't have that on the glass, the water will get inside, right?
Right, yeah.
So if you don't have the cuticle, the fungal infection then proceeds from the nail into the skin fold. Now remember that infection would result in an abnormal nail, but it doesn't necessarily mean that the nail is infected with fungus.
Right.
Now that is treated with antifungals, but it's also treated with anti-inflammatories and cortisons. And sometimes we inject cortisone into the base of the nail. So please see your dermatologist and you'll get the best solution there.
This message says, Salams for him, Jazakallah to Dr. Raboubi. He is a doctor who will make everything so easy and the fungus will disappear also. He is so jolly and excellent with his answers. May Allah subhanahu wa ta'ala reward you, doctor, and your team.
Ameen, ameen, ameen. Thank you. Jazakallah very much for your du'as. I really appreciate it.
Okay, next one says, I just want to know why my child's eyes and eyelids are so red. It gets more red when it's very hot. He's 6 years old.
I think we need the ophthalmologist for that one. But if it's the eyelids that are getting red, then it's our department. Right? So red eyelids often happen because of an eczema, because of an allergic reaction. So the first thing we need to look at is any allergy, to find out what is being applied. And remember the condition we mentioned earlier that's called seborrheic dermatitis often affects the eyelids of children. And we need to make sure that it isn't those two things. Of course, if the inside of the eye, we're talking about the actual eye that's red, that I'm afraid is outside my field of expertise.
Right.
And that would need an ophthalmologist.
Now this one says, for fungus on my nails, what can I use?
I think we've covered that in great detail, but I think probably the listener was not on the air at that time. So for fungal infection of the nails, remember it is vital to make the diagnosis first. And please don't go and put fungal infection treatment for 1 year on the nails without confirming the diagnosis.
Right.
Because that would mean, that it might not be a fungal infection and it's a total waste of medication, oral medication, and the risk of side effects and so on. These days we do dermoscopy on the nails. In other words, we use a special equipment to make a diagnosis without even having to send specimens off to the laboratory. So the treatment could be external, it could be internal. And it depends on what we culture in the laboratory and what we see with the dermatoscope and what it looks like to the naked eye. And that would determine what medicine we use and how long we use it for. Typically, we can apply a medicine or we can take it orally. And the oral medicines can be given one week in a month. It can be given every day for 3 months, or it can be given once a week. Those are the oral ones. Okay?
Right.
And the topical ones, they can be used once a week, or they can be used, well, usually there's one available that can be used once a week. So those are the treatments. But which one you're going to use and whether you're going to use it at all or not, let the dermatologist have a look at you and decide.
This one says, my daughter had a foot infection in 2022. It started as a small pimple under her left foot. After coming back from the beach, then it filled up with pus and became so painful she could not walk. She soaked her foot in potassium solution and later took antibiotics. After about 6 months, the infection cleared. Now, 4 years later, the infection has returned in the same area. Should she continue soaking with potassium, or is it better to get treatment?
No, go and get it checked out, please, because you don't fool around with infection on the foot. It sounded like there might have been an injury, like a cut, which got infected subsequently. And that sounds, if you got pus is equal to bacterial infection. So there was a bacterial infection that then spread to the skin, which can cause a cellulitis, which means a red inflammation around the area of an injury. And or it could have been a boil, one of those two. And those would respond to an antibiotic. If it's recurred after 4 years, then we are not even going to regard it as the same infection. It's an entirely new thing that would need a new diagnosis and a new, fresh approach to treatment. So go and see your GP, go and see your dermatologist, and find out what it is and get the treatment accordingly.
Inshallah. This one says, Salams, Doc, I've been diagnosed with chronic urticaria.
Yeah.
Okay, you know what that is, eh? On my face, and I have swelling of the eyes, lips, and hives. My throat closes and battle to breathe. What's the cause of this? I'm having frequent reactions. I can't take any anti-inflammatory and seafood. Please advise on what test should be done, Jazakallah.
The best test to find out what is causing urticaria is, in fact, a good history. And there's nothing like a good history. So in my practice, I would give the patients a diary to fill in for 2 weeks, a food and drug diary where they would record all the food and the drinks that they have. And I give them a list of the different categories of conditions that can cause urticaria. And I ask them to fill that in if they've noticed anything there in that list that causes the problem. And that would include things like medicines, food. It includes bites and stings and injections and infections and systemic conditions, in other words, diseases of the body. And it includes a category that is called physical urticarias. In other words, urticaria that can happen because of heat, because of cold, because of pressure. All those things can trigger off urticaria as well. Now, urticaria is commonly called hives, and typically what it looks like when you look at the skin is like whip marks on the skin. If you take a whip and whip somebody, the skin swells in those areas. That is hives, that is urticaria. That's what it looks like. Now, when it involves the lips and the eyes, we call it angioedema. It puts it into a separate category of very severe urticaria. And then we need to use systemic medications. Now, I want to say that there are many antihistamines that we use for this. First, we use it as a single dose, then we double the dose, then we quadruple the dose. But if those antihistamines are not working, then we use a biologic medication. And that biologic medication is called Xolair, that we give by injection. It's expensive. It costs about 10,000 Rand a month.
Sure. Okay.
And that's for one injection. But it controls the urticaria like we've seen nothing else control it. So if you have urticaria that is so severe and is closing your throat and so on, a medication is available that can help you. So please go and see your dermatologist and get his or her opinion about what you need. Thank you.
Jazakallah. Doc, we're getting tons and tons of questions coming in. I think we'll have to bring you back.
Definitely.
Because time's run out.
In fact, as doctor is speaking, I think maybe he should do a weekly segment on the skin.
Right.
Like the skin is big. So, I mean, there's a lot he can cover.
It's the largest organ in the body.
Exactly.
So we're going to have to do that. So guys, who've ever sent us messages and we haven't responded to you, it's because of time. But inshallah, we will try to get Doctor back into studio to answer more of your questions. But finally, Doc, what is your main message to the Muslim community about the prevention of fungal infection?
Right. When we are in the mosque, we must not scratch our feet.
Right.
And if there's nothing else that we take away from this, that's what I want to emphasize. Right?
But if it's itching?
If it's itching, go outside, scratch it and come back. Or put your socks on and come back. Because you're going to leave those scales on the mosque carpet. Others are going to walk on it and they'll go home with fungus. Then they'll give it to their wives and children. And you won't get any blessings for that. Nobody's going to make dua for you if you give them fungus.
It's true. Right.
So wipe after wuzu. Wuzu is a hygienic practice.
Yes.
Dry the feet thoroughly because of the nature of our wuzu khanas and mosques. Dry the feet thoroughly. And if you have a fungal infection, then keep your socks on until you get your fungal infection sorted out so it's not spreading to others. And please, no scratching in the mosque. And please use the paper towels provided. And for the mosque, we'd like to engage them and see what detergents are being used to wash the wuzu khanas and what is being used to use the carpets. And inshallah, very soon we'd be able to work out exactly how to disinfect our carpets and wuzu khanas. Our campaign the last time was very successful, and we hope to run that campaign again. And we'll try and make some posters with pictures depicting fungal infection to show the musallis what it looks like. And if they can identify with anything there, then they must go and see their general practitioners or their dermatologists and get it sorted out. Inshallah.
Well, Jazakallah, thank you so much, Doc, for joining us. And we will talk to you again very soon, inshallah.
And don't forget, you share your samosas, but not your fungus.
Absolutely. But I'm going after Tarawih fish and chips.
Watch away.
Well, that's it for the show today. We shall do it again tomorrow. Oh, yeah, quick live read. Yeah, there we go. Go for it, Ted.
Go for 10, 3, 2, 1, go.
Well, I have great news for members of the Discovery Care medical aid, Linmade Shifa Private Hospital has been selected as the designated service provider for the Discovery Key Care and all their patients. They now offer a neuro and vascular surgery services, further strengthening their community and better serving our community. Now, it expands and accesses to specialized care with a mission to create a healthier and more prosperous community. Linmade Shifa Private Hospital looks forward to welcoming more of you and to take care of you. Now visit linmadeshifa.com for more information at linmad.com. Linmad, embrace every day.
Sharp, man. Have a great one. We'll talk to you tomorrow, same time, same place, right here on the Afternoon Jam. Have a good Monday evening. Enjoy your Tarawih and Seri as well.
You as well.
From me, Fahim, and the team, we say no to drugs.
Respect you.
And be the best that you can be. Assalamu alaikum wa rahmatullahi wa barakatuh. You say enough, Jen.
The Afternoon Jam is brought to you by Spur, people with a taste for life.
As the sun sets and the day slows, it's time to gather, time to share, time for iftar at Spur. Enjoy a juicy 150-gram cheddar malt steak, 4 buffalo wings, 2 crispy samosas, and a chilled glass of faluda for $219.90. Or enjoy the half cheddar malt chicken schnitzel with all the same delicious sides for just $199.90. Available at all halal Spurs till 19 March. T's and C's apply. Spur, people with a taste for life.
During this auspicious month of Ramadan, spread hope by bringing relief to those in need. Contribute towards Gift of the Needy's Ramadan hampers. Syria and Palestine from 2,000 Rand. India and Rohingya from 1,200 Rand. South Africa and Malawi from 600 Rand. Your generosity will ensure that those less fortunate feel the true spirit of Ramadan. Donate your zakah now. Standard Bank Gift of the Needy account 272 327